Strokes are not something to be taken lightly, even if symptoms appear minor. In the United States, strokes happen once every 40 seconds and someone dies every 3 minutes. There is medication for strokes, but to work, patients need to receive the drugs within the first 3 hours after symptoms start, and many people wait too long to seek medical attention. The average wait time is 15 hours, way too long. A new app could help cut down on that wait time. Joining me this morning to discuss how this app works is our 9 News health expert, Dr. Kohli. Thank you so much for coming in.
Good morning.
This hits home for me. I have a family member who suffered from a stroke a couple of years ago, and I know it's all about timing. So first, why do people delay getting medical attention for so long?
You know, stroke, Corey, is one of the most feared complications for any of us. Many of us would rather die than have a stroke because it can be life-changing. And what we see is that people don't really realize that they're having a stroke. So awareness seems to be one of the sort of biggest issues that drives the delay. But what we also see is a big piece of denial. So a lot of people minimize symptoms when they have a stroke. We do see that people who live alone tend to delay more, actually, because a lot of times it's somebody else who's with you who recognizes the symptoms, like a facial droop or asymmetry or issues with balance or what have you. Women tend to delay more, minorities tend to delay more. So there are a lot of complex reasons why people don't get to the hospital in time.
All right, so what are the symptoms that people should be looking out for?
So the acronym I want you to remember is FAST. Okay, F stands for facial droop or facial asymmetry. A stands for arm weakness. S stands for speech issues, slurred speech, trouble with word finding, using the wrong words. And then T is the most important one, time. And that's really where we see so many people delaying so much. We see 40 to 60% of people presenting outside that window where the medications actually work the best.
The family member that we had that suffered from a stroke, I think it was speech first. So it can be all of these, it could be one of these, right? Anything that just seems off.
That's exactly right. So what happens with the stroke, and the most common stroke is what's called an ischemic stroke, which is a blockage. So our brain has a blood vessel network that feeds it. If you get a blockage in one of those blood vessels, the part of the brain that's fed by those blood vessels sort of dies off. So depending on which blood vessel, the size of it, the area that it supplies, whether it's a language area, whether it's a speech area, whether it's a motor area, whether it's a sensory area, you could even have mild symptoms like numbness. Sometimes if you get it in the back of the brain that controls our balance, you could just have kind of feeling a little dizzy or lightheaded or what have you. So it can be highly variable. And if it's a big blood vessel, one of the ones that kind of goes up before it branches, then you can have all of those. So it's really important to keep a finger on kind of what it could look like.
This medication is huge, but as we mentioned, it's all about time. And talk about why this is like a couple hour time period that you have to recognize the symptoms, get in and get the medication.
So every minute that you have a blockage to the blood vessel in the brain, you're killing nearly 2 million neurons. Wow. So time is brain, is what we say. In fact, at the hospital, when somebody shows up and they have some funny symptoms, we call what's called a code stroke. So we call it overhead, everybody rushes in there, they rush them to the scanner because it's about opening up the blood vessel, either with medicines that break up the clot or going in and actually sucking out the clot. So getting to the hospital in a timely manner, first of all, restores most function because that tissue can kind of heal itself. But secondly, if you're outside that window of those medicines, then you actually just have to wait for the stroke to complete, and there's not much you can do.
So talk about where this app comes into play and how it can be so helpful.
Yeah, so because people don't really realize awareness, our brain tells us about stuff. And when the brain is diseased, we sometimes don't have awareness that something bad is happening. The app actually can detect things for you. So when you come to the hospital, the doctor would do what's called a neurological exam, where they check your facial symmetry, they check your smile. So you pull up the app and you look in the camera and it looks for facial symmetry. It makes you smile, it makes you blink, it makes you stick your tongue out, and then it makes you tap with your right hand, makes you tap with your left hand, and it can detect based on the haptics, the strength of tapping, whether there's any asymmetry or weakness. And it's set up such that it has a low threshold to tell you to go to the hospital or call 911 right away. And really what they're looking to do is to validate the app. So where it's headed in the future is if you've already had a stroke and you already have some asymmetry at baseline, can you still use it? Because we know that 1 out of 4 people who've had a stroke will have another one. Right. But for me, this is an exciting way to bring the doctor into your home, especially since delay is such a big problem. We're trying to raise awareness. It's not quite at the point yet where everyone's going to download it because it's not approved and validated. But if it does end up getting approved and validated, this is something, especially older people who might have limited insight into their strokes, would have on their phone. It could save a life.
So people can't download the app right now?
Not yet.
It's in the process.
It's
Okay.
kind of in a research phase right now, but they're going to validate it and make sure that it works properly, because what you don't want is an app that leads you incorrect.
Absolutely.
But what we're seeing is in medicine is technology being brought into people's phones as a way to guide them, even in decisions of whether to start a cholesterol medicine or what have you. So I think this is the future of medicine.
Yeah, it's huge. Well, Dr. Kohli, thank you so much for coming in. Appreciate it. You can find all of Dr. Kohli's appearances at 9news.com/Dr. Kohli. Chris?